Hold on.
Okay. See what are we?
Ready?
The time.
5, 4, 3, 2.
Good afternoon. Good morning. Good evening. Hope everybody is doing wonderful wherever they are. And today we're up with data mining. Last time we were looking at information security. And as a result of looking at information security, we got a very good feedback. And we decided that some of the many things that we can do with data. And today we're going to look at data and data mining. My name is Kilian Somewhere, and I am the president of the Global Healthcare Foundation. Global Healthcare Foundation has been around for the last years, development management and systems, and do a lot of work in the area of medical services, medical devices, medical reagents, and helping medical organizations be able to strengthen their medical systems as well. So to be able to talk about data mining, I have to look at 3 of the deep areas that are being looked at today. The first one being deep learning. Deep learning is actually a subset of machine learning, and there's a subcategory in that particular area, which basically uses a set of algorithms to be able to extract what the future is going to look like. And machine learning is the systems and the algorithms that are designed to be able to learn and make predictions with known outcomes. And then, of course, artificial intelligence, which has been spoken so much of and has truly been around for a very long time. It's a much broader concept of intelligence that demonstrates, that is demonstrated by machines, but also depicts what we expect from human beings and their behavior. So in these 3 areas, between deep learning, machine learning, and artificial intelligence, we are able to collect a lot of data. In my webinar last week, I spoke about the Internet of Things. And when we look at the Internet of Things, basically we're looking at huge data that is being collected, whether we are collecting it from our cell phones, or we're collecting it from our vehicles, or we're collecting it from one of the many devices that we have. And all of that data is being collected into different databases, and it is then used to be able to make decisions for us. And that's where we want to go to with data mining today, is to be able to just look at the tip of the iceberg and see how much data there is out there and what the number of industries could potentially use this data for. So just to be able to go back and look at this, artificial intelligence, it's really the broad area of computer science that makes machines begin to behave and use and act like human intelligence. Because of that, what literally we're looking for is we're looking for equipment for machines to be able to simulate what human beings would have done under certain conditions. And the example that is given here is human-like behavior with road rage. That's actually a very high level of artificial intelligence. And when you look at artificial intelligence, what actually stacks up artificial intelligence? Artificial intelligence is stacked up by those 5 dimensions here. It has sensors, it has a human artificial interactions, it has the autonomy of being able to make those decisions by itself. Then it has to be able to search and make plans. And then there is machine learning and the deep network that actually allows you to be able to get to that. Then within artificial intelligence, there are 3 areas to be looked at in artificial intelligence. There is the narrow intelligence, basically narrow artificial intelligence is goal-oriented. Basically, that's where we are today with what we know. So basically, those of you who use the iPhones and you could talk to Siri and ask her where your best restaurant is, and it could tell you exactly where it is. That is basically the intelligence that we have today, artificial narrow intelligence that leads you to that. Then there is artificial general intelligence, basically the ability to learn and understand what is actually going to happen and act in a way that is indistinguishable from humans. So basically gathering in information and simulating what a human situation or human action would be. Then of course, this is into the deep future. Artificial superintelligence. This is the machines actually simulating the brightest and the best of us as humans. So Tom Mitchell actually used to be the dean at the Carnegie Mellon University, and this is what he says about machine learning. Study of computer algorithm that allows computer programs to automatically improve through experience. So this is computers getting so much data. I just give you a very, there are vehicles out there today, and basically one of the things that artificial learning will do for you is that artificial learning actually takes information on how the driver would like to sit in the car. And basically it collects a lot of data on different drivers, different sizes, different lengths and that kind of a thing. And when you sit in the driver's seat, instantly, as soon as the car comes on, you would notice that the driver's seat begins to adjust itself, whether it's the rear back coming forward, the chair itself moving forward so that the legs can get to the pedals. And those kinds of things happen. And this is basically data that has been collected for different types of potential drivers and stored into the memory chips of these vehicles so that now they can respond to different sets of people as they come into the driver's seat. So within machine learning, you find common patterns. And basically when you're using machine learning, let's take the case of healthcare. So in machine learning, basically what would happen is if you're going to do x-rays, for example, a bunch of pictures are going to be loaded onto a database. And the machine actually goes through and it actually maps all these pictures and it comes on with specific parameters for all the mapping that it actually does. And then later on, when you now go on and then you load the same equipment with a different set of data, basically the machine has learned from previous data what it expects to see. So basically what it will do now, it's going to compare the parameters from the previous data that it had with the data that has just been loaded to disclose how likely the pictures contain any of the indications that it had previously identified to be able to help with predictions into the future. Again, machine learning has three broad categories that we can look at. And basically what we are looking at here with machine learning is yes, supervised learning. This is really where we are today, because in supervised learning, there is an input of a number of known variables and an output of variables. And basically what you have here is an algorithm that actually takes the learned input and then tries to map out what input to output is going to actually look like. And this is truly where we are with what is going on today. It's really supervised learning. So there is so much information that has been collected through our Internet of Things and all the devices that are out there and all the purchases that we do with our different forms of cards. And then the next thing you would find from there is unsupervised learning. Unsupervised learning is used when we do not have a labeled data. So we basically just have huge volumes of information. And it is now expected to take all of this huge data and start figuring out what kinds of categories it could potentially fall into. Its main focus is to learn more about the data by interfering patterns so that there is a whole data set which you can now go to and refer to. Say, for example, you want to buy a camera and you go onto eBay and you select cameras. But now one of the things you did not select, is the fact that did you want a blue camera or did you want a silver camera? So if you don't tell what kind of cameras you want, you eventually end up with a bunch of cameras, but that's unsupervised learning. Then there is reinforced learning, which is basically another type of learning algorithm that allows you, in which the agent learns from an interactive environment. So it looks at the environment in which it is working in a trial and error way, it continuously develops feedback from previous actions to be able to give you an experience going into the future. So that's what you have with machine learning and the different categories of machine learning. Supervised learning, we know what we have, we predict what we're going to get. Unsupervised learning, we have a bunch of ducks and we try to figure out whether everything that comes up on two legs, got a bunch of feathers, might be a duck. Or reinforced learning, where we're looking at our environment and getting the information from the environment and try to use it into the future. Okay, so now going forward, the big conversation for today is data mining. So what's data mining? Data mining, data mining. There's so much talk about it in all the industries today. And basically we're trying to figure out what is data mining as we go on. It is basically a process used by companies, all the businesses out there today are trying to turn raw data into useful information. And there's all kinds of things that is happening with as people try to collect this raw data and turn it into useful information. Whether they're using softwares to look for patterns, the data to see what people are buying, effective marketing strategies to increase sales, try to decrease cost, all kinds of innovative things that people are trying to do to be able to see how they can make a big dent into the market. And so basically they're trying to use the data to be able to say, how do we increase or expand our business? So when you're looking at data mining, especially in today's world, there has been so much talk about big data. And big data is just massive, huge volumes of data kept on different databases, different data sets. Then there is, of course, the data analytics that needs to go into that, the data lake, data privacy, which we looked at in one of our last webinars when we spoke about information security. So there is the whole area of data privacy. Then data warehousing, how much of this data could be kept, where is it kept, who is keeping it, and talking about cloud systems. And then data mining, which is where we are today. But as you look at all this, whether you're talking about big data analytics, lake, privacy, housing, or data mining, this is where we are today. It's all about data mining. And some of the interesting things that happen with data mining is airlines have been able to go and use data to be able to predict which of their clients is going to be late for the flight, or how many clients are going to be able to book flights at the last minute. So you have a lot of airlines that have some of those black seats, as they've come to be known, because they know they have a certain clientele that is out there that is just going to book late. And then data mining has also allowed the people in the medical field to be able to tell, is it a baby boy or is it a baby girl? Or when is she going to be pregnant? When are we going to get the baby? And all of the things that go around healthcare. Data mining, the sets of information that we have right in our hands. And every time we use our phone to scan any piece of information, at the same time, we volunteer information when we're doing that scanning. It says how old we are we male, are we female, what is our location at the moment, what are we trying to buy, what is the gift we're trying to get. So there is a lot of information that is instantly being transformed into a database and created into a data set that is soon going to be used in a few seconds from after it has left your phone to turn around and sell a product or services right back to you. So doctors use it to check whether premature babies are developing any dangerous infections. That again is a number of data points, data sets that they look at. Insurance companies love data mining because it allows them to tell what is going on with their elderly population, what is going on with that pool of clients that they have that they're really worried about. How soon would they part ways with life and earth? And so they can provide counseling for them. eBay has used data mining very well, in able to be able to distinguish what kinds of categories. If you signed on to eBay, if you decided to get a computer, what else would you get? Would you get a surround sound music system? What would you buy when you get there? And so as soon as you click pens, it's instantly going to say, oh, you bought pens. The last person who bought pens also liked these calendars. And what it does to you is it actually instantly points you in a direction for more spending. Abnormal detection used by the revenue departments of lots of countries to be able to spot people who are going to try to evade taxes, or credit cards people use it to find out if to flag transactions. So if in the last 2 to 3 years, your credit card has never been used in a furniture shop, and all of a sudden your credit card company sees you spending another $4,000-5,000 in a furniture shop, that instantly allows it to be able to flag and say, hey, something might be going on. And then you quickly get a call that says, hey, look out, is that you doing the shopping, or is somebody else doing the shopping on your behalf? Association learning, basically, data mining allows us to be able to say, oh, one of the big shops was able to detect and say, this is what was happening on Friday evenings. All the men who came into the shop bought beer and they bought baby diapers. So what does that say going into the future? It means going into the future, when the layout of the shop is going to be put, we're going to have baby diapers and we're going to have beers in the very next aisle, so that it is very easy for them to walk in, pick up the baby diapers or pick up the beer, and not have to go too far and find the next item that they need so that they can check out. So all of this is what data mining is doing, is allowing businesses, is allowing organizations to be able to see what is going on out there and how do they position themselves to be able to provide the right product or the right service to the clients that are out there. So basically, data mining actually has 5 structured areas. It could be classification, regression, it could be clustering, or abnormal detection, like we just looked at with the credit cards, or association learning, which we just looked at very lately, in terms of what are people's spending habits and what are their natures. So when you look at data mining, it's a very straightforward process. So there is, first of all, the selection of the data. Again, as I mentioned earlier on, there are huge databases out there, and in data mining, basically we have to be able to pick some data sets as we develop the different algorithms that are going to be used. So you have a selection of the data that is going to be used. Then the next thing that happens is you try to process and clean up the data. So you might have huge volumes of data all around what are people's shopping behaviors. And then you clean up that. If you just want to find out, are people going to buy food items, or are they going to buy household items? Are they going to buy it on Monday, or are they going to buy it on Wednesday? And you could clean out that data and you could be able to see that. And then you could go on to do the processing. So by the time you get to processing and selection of the extraction, you basically are right down the road into your data mining. At this point, you basically are going to be making interpretations. So for people who live in a system where I could tell by your address that this is your zip code, and as a result of your zip code, this is where you live. Basically, by using your zip code and data mining, it is very easy to be able to tell what are the things that people who live in a specific zip code are going to be buying. And as a result, they would have very specific coupons sent to them. There is a classic case of the gentleman who was suing this supermarket for continuously sending coupons to his daughter about baby wear and the baby pants and those kinds of things. And he actually was attacking the supermarket while they were sending these things to his daughter. Little did he know that his daughter had actually been looking at these things online, and as a result, her data had already been gotten into a database, and they were able to tell that she was an expecting baby. And it now so turned out that the supermarkets and the data collection people actually had information about the man's daughter, which he didn't have. And why? Because she was actually out there looking at different things on different sites, and they were able to collect data on her and be able to send to her information that she could potentially use when she has the baby. So going forward, healthcare data. Following the COVID pandemic, healthcare has suddenly come to center for everything else that we do. And there is huge volumes of data from the second you're conceived in the womb, and people are trying to figure out whether you're a female, baby boy, baby girl, whether you're going to be a bouncing baby boy, bouncing baby girl, or how you're going to be born. There is all of this data that is being collected. Insurance data is collected, laboratory data, all of this data that is collected around healthcare. Basically, what it does is it helps in diagnosis, it helps in predictions, it helps in effective treatment, but it also most importantly helps in healthcare management. With healthcare management, data mining applications can be developed to better identify and track chronic diseases. There is so much data out there now that is saying that if you looked at the African continent, there's a very huge divide. There's a big case between children between 1 year and 14 years, and people who are greater than 65 years of age. And that is all from data mining that we're able to say that 65 years and above, they're going to have NCDs as opposed to children between 1 and 14 years of age. And this allows for better healthcare management. Then customer relationship management. Again, all the data that we have on the patients or the clients, a reduction in insurance fraud and abuse. Human Services Guarantees develop a model to distinguish abnormal examples of cases by patients, doctors. This is really huge because when you're looking at insurance and patients going in and people using other people's names, it's very easy for the health insurance to be able to say, no, you've been a client for the last 14 years. And when we look at your ailments and we look at your history, this does not look like a right prescription. And then they can go on and call the doctor, and they can easily be able to follow up on fraud in that case. Medical device industry, this is a huge growing area. As we speak today, there are well over 736 companies trying to produce testing platforms for COVID. There are at least 6 to 9 vaccines that are going to be available within the next 18 months for COVID. And all of these have to go through different devices and different industries. And data mining becomes really important in terms of trying to determine, make better decisions in our life, and also to improve the healthcare of people. So basically, this slide just takes us in some more depth into some of the things I've just looked at. What is going on with healthcare financing? We're talking about insurance companies. We're talking about trying to insure more people. We're also talking about looking at the pool of people that we have and trying to distribute the risk. And this is very big for insuring companies to be able to know where the finance is, to be able to know what the disease patterns are, and to be able to know what they're going to insure. But then, of course, there is the big question of security and privacy of data. We looked at our last webinar, we were looking at information security. This is a very, very important area today. Again, when we talk about the Internet of Things, there is huge amount of data that is out there. And how do we ensure the security of this data? But again, as I've said many times before, we have the data in our hand, and we're the ones who are the weakest link in the security of the data in terms of sharing it out, and anybody who needs it to use it with us, for us, against us, we're actually the ones sharing it. Then disintegrated data points, we just saw a few minutes ago when we're looking back at healthcare. There are so many different points where data is being collected for so many different reasons. And if we could actually start integrating this actually would help us get the points. But I think this last one at the end here is a very interesting one, because when you go into healthcare, we have all the healthcare people, we have nurses, we have doctors, we have radiologists, we have all of these people, but we just don't have enough IT people to be able to manage this. And truthfully, when we look at data mining is actually the newest kid on the block when we think about all the things and all the other industries that have been out there using data to date. So some of the benefits associated with this, advanced patient care, of course, that is very, very important. Already we're just about 8-9 months into COVID. But because of data mining, we're already able to link different diseases and consequences with the COVID pandemic. Whether it's TB or it's obesity or it's hypertension, we're already able to tell from data mining what the relationship is between both and the potential of what could happen to patients who actually turn up to be COVID positive. Improved operational efficiencies, that is just phenomenally important. If an ambulance picks you up and you're 7 to 10 kilometers away from a facility, because of data mining, we could easily be able to get very basic signs off of you right after you picked up into the ambulance. And by the time you get to the hospital is waiting for you. There is already a set of a medical team that already knows exactly what could be wrong with you and what to do with you or how to receive you. That's really important. Error minimization and personalized treatment and care. We're so fast because of all the data that is out there and all the things we know about people. We're so fast and we're moving right now into genomic studies, and we're getting to the point where everybody is going to have to be a single individual, and pharmaceuticals will be much more expensive than they are today, because we'll be making pharmaceuticals for a person as opposed to for a group of people. Once we can get a good genomic study on every human being on earth, we'll be able to tell exactly what medications they need, and we'll be able to treat them as individuals as opposed to clusters of people. Then, of course, public health planning. It's all on data. Just a very simple example we look at with the COVID pandemic. One of the big things that has come up has been as a mode of prevention, people have had to wash their hands, wash for 20 seconds and greater. But when you look at the public health nature of a lot of places, there is just a little over 34% of the African continent has access to flowing water or to potable water. What does that mean? It basically leaves you with about another 66% of the continent without potable water to be able to have access to be able to wash their hands. So that allows us to be able to make some very important public health decisions as to where we want to put the sanitizers, how we want to treat the people, the other 66% of the continent that doesn't have access to potable or clean water. Very important public health decisions that need to be made. And all of this is in the data that we already have. It's just the data sets just need to be looked at. And then those sets of data need to go through different permutations to determine where and how we're going to use it. There's a very interesting story from AfriCell and data and public health. As AfriCell was able to tell and be able to pick out what would be the hot button spots in the Congo when there was going to be civil unrest, because all they needed to do was they were able to see the number of preloaded cards that were bought in advance, and they could use the number of preloaded cards that were bought in advance to determine hot areas or areas of disturbance during elections in Congo. And that allows for quick public health interventions in terms of ensuring the safety of people. Of course, data mining make informed high impact business decisions based on data insights. So in terms of what kind of care do you want to put and where do you want to put that care, that becomes very important. But once we have data on what is going on, what are the distances between primary healthcare centers and tertiary healthcare centers, what are the kinds of ailments that are going to be found in the different sets of people, then we can make very important kinds of decisions as to what are the kinds of doctors we need where, what level of healthcare is actually needed in those different areas. So data mining is just really important for healthcare decisions, for policy. So jumping into agriculture, so these two actually go together. If you're going to be healthy, they say you should eat healthy. So if you eat healthy, you're going to stay alive longer and you're going to be healthy. So those two, agriculture is just so important. But we look at the slides I have up now, and a long time ago, nobody had any information on what was going on in the farms around us. So it was very hard work, heavy duty work. It was, everybody was stealing and toiling all over the place. There was no information. The farmers were mostly the women They went to the farms with the children, and very hard work. And then you look at where we are today with all the data sets that are out there, all the devices that are there that will collect data. Something as simple, again, I'm going to talk about water. Water is one of my pet peeves, but it's because it's just so important. But now with the data that we have, one of the things you look at today in agriculture, a few years ago, when you had a huge 50-acre farm, you would water 50 acres of the farm. But today with data and the technology that is out there, you don't have to water 50 acres of the farm. You could literally tell by just flying a drone over your 50-hectare farm and be able to tell what parts of the farm is actually dry. And so you could actually target your watering of the farm to those very, very specific areas, so that instead of spending huge volumes and huge gallons of water going through a 50-acre piece of land, you could now be able to very targetedly water just the places where there is a deficiency in the water that that area has, so that you ensure that the farm has the same amount of growth. This is exactly what I'm looking at. So you have a drone that flies over the farm and it's able to tell what is actually going on. I believe in the future of agriculture with the faith born, not in words, but in deeds. Your drone could fly around and it could actually bring back information as to what needs to be done for the different areas of the farm. How much more fertilizer is needed? Do you need to put fertilizer on the entire 50 acres of farm, or do you need to put fertilizer on 15 acres of farm? This is very important information. And now you don't have to walk through your 50 acres of farm for the next 2 weeks. The drone could be up and around in 2 hours, and you have a very good picture of what is going on with your farm. So again, looking at some of the benefits in the area of agriculture, of course, it's going to boost productivity. You don't have crops that are going to be flooded because you're trying to have enough water and irrigation to the farm. The farm is evenly watered. Manage environmental challenges that you can see. Then, of course, improve supply chain management because you have the information that you need to have, whether it's the weather, whether it's how much rain you're going to have, when is the rain going to come, the crops, how the crops doing. All of this data you could collect. But again, there is already a lot of data that has been collected around the different crops. So all we need to do is in data mining, see what is going on, when it is happening, and then how to be able to act going forward. Planning and forecasting, a huge impact on the markets today, huge impacts on the markets. You have the right amount of grain at any given time, powerful to trading, negotiating and market access, very important as well. But also it allows us to be able to control the other risks that are associated with food. You have very big established, whether it's hunger that is going on, shortage of food in many different areas. But with the data mining and data sets that we have today, a lot of these can be looked into and a lot of this can be projected into the future so that we can actually help whether it's different regions, it's countries, to be able to move, whether it's grain or other types of food into different areas to be able to support this. But again, of course, there are always challenges. Poor communication infrastructure is still one of the biggest handicaps behind agriculture. Just knowing what is going on. The guy is out there and he's doing farming in vanilla coffee, and he needs to be informed about what is going on and what are the pesticides that would be associated with vanilla coffee. There is huge communication infrastructure gap that needs to be met. And so there is some data sets that need to be gotten in that area. Minimal farm record. Again, we're now moving into an age where we can fly drones over the farms and be able to see exactly what is happening. But just a few years ago, there were almost no records on what happened. The only time you knew what anybody had was when they put all their grain in the back of a truck and drove it to the market center. If they didn't do that, you didn't know they were actually farming in grain or wheat or any of that. So today with data mining, we're able to tell what is going on. We're able to tell where the farms are and what they need. But then, of course, there is still the issue of siloed data management. It's just one crop at a time, as opposed to what are the crops that are out there, what region are these crops in, what is going on with these different crops. So those are things that continue to be of interest. And yes, I guess you noticed, just as I noticed, I have my medical doctors in their suits, but I'm actually trying to talk about the weather patterns here. Climate change is real. Climate change is real. Climate change is actually happening. And then we have increased weather variability. So we have people who had projections of when they were going to start farming, when they expect to have their harvest happen. But climate change is real, and climate change is one of the big impacts of climate change, of course, today is the yield in the agricultural sector and what it means for a lot of people. But then, of course, after saying all of that, there is huge opportunities around data mining. It helps with planning, collection of data, tells us a lot about the different landscape, what we can do and what we cannot do. Then, of course, again, going back to healthcare as I close, there is so much data that is out there. There are lots of different algorithms that could be used with the data sets that we have. And using all of these data sets is actually going to propel us many miles ahead. But we just need to be able to use some of our deep learning, some machine learning to be able to figure out where we are, how we're going to use the data, and be able to ensure the fact that we're able to use it responsibly, not to be able to try to fly people off the road, but to be able to use this responsibly. I never like to end one of these without talking about where we are today. COVID is still around. COVID is very real. So please, we want to continue to take our temperatures. We want to check our bodies. Wash our hands minimum for 20 seconds. If you could do more than 20 seconds with running water, that is always very nice to do. In the absence of that, I just mentioned that there is just a little over 34% of the African continent with potable water. Then we are going to use sanitizers. But again, this is data and this is information, and this is able to tell governments where we need to be able to channel the sanitizers to be able to reduce potential infections. Then, of course, we need to have a good face wear that we can wear at all times and still continue to maintain a good social distance. We need all of these things to be able to keep COVID-19 at bay. Thank you so very much indeed for listening. Thank you so much for being with us as we went through this. Always remember, you are the weakest link with the data that you have. When you think about all the gadgets you have, whether it's your phone, 2-3 phones for some people, your laptop, your iPad, or your pads, or whatever computers you have, there is a lot of information there. Every time you like a Facebook page, every time you scan something, yes, there is transfer of information. And so, yes, you will get a coupon in your mail that tells you your favorite restaurant has your favorite meal every Thursday, and you wonder why or how. Yes, you did tell them. At this point, I would stop and I would listen to anybody who has some comments, some remarks. I'll be very glad to take them now. Again, if you want to reach us, certainly you could just drop us an email, info@globalhf.org, or give us a call. You could also catch us up on Facebook, share the link, share as many times as you possibly can. You could catch us on the web as well. If you just happen to be traveling out in Uganda and you want to stop and see us, yeah, I'm speaking right now from Kololo. I am in Uganda. I see there is somebody who wants to say something. Please go on.
Yes, thank you.
Just tell us what your name is and where you're calling from.
Thank you. I'm Eve Namisango, and I'm calling from Makerere University. And my question is about your thoughts on how we can move data mining forward in the health sector amidst the need to protect patient identifiers and working around patient consent to use their data for whatever purpose.
Thank you so much indeed, Dennis. That's a really big concern, and thank you for raising that up. The issue of confidentiality is big as we continue to, as this whole industry goes forward. Confidentiality, it's very strongly tied to ethics And so it is our hope, whether you're in a healthcare facility or you're working with your insurer, that they're going to be able to keep as confidential as possible all the information around your person, whether it's your name, your location, where you could be found, and those kinds of things. But again, as I said earlier on, more often than not, Dennis, it's us who provide this information. It's us who are always telling people things about ourselves, and we do it very unconsciously. Again, the simple example I give is you showed up at a very good restaurant or a favorite restaurant of yours, and you had a great meal, and on your way out, they say, oh, could you please just fill this evaluation form? And guess what the evaluation form is going to ask you? It's going to ask you what your address is. It's going to ask you what your phone number is. It's going to ask you what your email address is. And then it's going to pretend and ask you a couple of things about how you are. Guess what? The next time when the dish you had is up on the menu, you're going to get a call, you're going to get a coupon that says, oh, next week we're going to have lasagna, and it's going to come with ABC salad, and it's going to have this kind of sides. And you wonder how they got that information. Actually, yes, you gave it to them at the last time you were out there visiting. So I think, again, it goes back to my last webinar when we spoke about information security. There is so much data that is being uploaded to the cloud. Just a few weeks ago, there was a big break-in with Facebook, and so many people's identity was out there and people are using it. We are preparing for elections right now in the United States, and there is so much data that is out there, and people are trying to figure out who is going to vote how and what do they need to hear to be swayed to move from one candidate to the next. So there is huge data out there, and the data protection, the encryption just needs to be made stronger. Security codes just need to be enhanced. And as I said once before, we need to start paying people to hack into our system so that we are able to tell that the system is strong enough and cannot be hacked into that easily. Otherwise, if somebody had to hack into your system out of their own voluntation, then by the time you find out that they're in your system, all the information is out. But I must agree with you, the issue of confidentiality, the issues of ethics are going to be very strong as we try to manage data mining for much more useful purposes. Okay. Okay. Any other comments? Anybody beginning to wonder how much data or how much information about themselves is out there? Okay. Hearing no questions, I guess between last week when we looked at information security and now we're looking at data mining, this actually just accentuates what is going on in the world today. People are working remotely. Most of the businesses have their staff working at different locations, which means there's a lot of data, and there is even much more data sets that are being collected, huge data warehouses that are developing at very huge speeds. Last week I mentioned that for the 7.8 billion people that are on Earth, there is more data for each of them to have 1 billion bytes associated with them. So there's just a huge amount of data that is out there, and using those different data sets in different algorithms is going to yield a lot of very important information that we could use going forward, whether it's for healthcare, whether it's for agriculture, whether it's for development purposes, whether it's for public health decisions, but if nothing else, for good policy to be able to keep us. I thank you so very much indeed for listening once again. You're very welcome to drop us an email, info@globalhf.com, or join us again at Facebook. Otherwise, I'll see you here. I'll see you again next week, same time, same place. Thank you so very much indeed, and have a wonderful rest of the week.